Alright, so I don't know if you can hear me, but sorry for the weird angle. I'm outside of the hospital going to have a very important meeting, I guess, with my oncologist to talk about the medication that I'm going to be taking and all the side effects. And what I meant to say before was that the medication that I'm taking has flu-like symptoms, not that it's, going to give me the flu or whatever, just in case it wasn't clear. So, I do want to the very, very awesome plants and flowers. Spring is happening. It's awesome. Hi, I'm Crystal. So, you just heard, or you just saw the clip of me going into the hospital and then me showing you some flowers. So, while I was in there, they gave me a really cute little tote that says the name of what I'm going to be taking. And so, yeah, so that was last Friday, and I know that today is Thursday of the next week. I got sick on Monday and Tuesday. So Friday I had the appointment, and then Saturday I went to both of my girls' soccer games, and then on Sunday night I started to get a sore throat and everything, and Monday I couldn't really speak, and then Tuesday kind of the same thing. It was difficult to really say anything, and it was just difficult to live. So I spent most of the time in bed, asleep, and yeah. So so on Tuesday I was feeling pretty down. Wednesday I was still kind of down. My voice was still not to perfect or anything, but I got my the Mechanist and the Taffenlar. I got it in the mail, and it came in an igloo, and I unboxed it and I did all that stuff, and I set it out, and I put I think it's Taffenlar goes in the fridge, and all right, so hello again. I am in a different place because I had to move because the light in the background thing was starting to bug me. So here I am in the bedroom again because apparently this is the best light. So there's a picture window right in front of me with clouds, and it looks amazing. And you know what? Here. Oh, there we go. Okay. Clouds and trees, and it's super awesome, and has a great source of light. So and the other one, there's a picture window in the living room, and I was in the dining room, and so the picture window, I guess, is a little far away, or the light in the back, anyway, it's fine. So lighting is better in here, so now I know. Okay, so I went to my appointment on Friday, and then so let's not go through all that. And then I was feeling bad. Then Wednesday I got the package, and it came in an igloo, and I thought I wasn't really thinking. I forgot to film the unpacking, but it's okay. I'll have another opportunity in a month because that's a 30-day supply. And so look forward to seeing that. I am so sorry. See, I'm really new at this, and me and the 5 subscribers, 6, I'm sorry, I got 6 yesterday, so 6 subscribers that I have. I apologize for just not really knowing what to do right now because I am new, but I'm excited, and I want to I've kind of decided what I would like to do with this. So I'm sick, but I want to show like the little things, like all the stuff that I've showed you, like the museum and the the Jurassic Park thing, you know. And I know that there are little adventures out there everywhere. And I don't know, eventually I'd like to go on a train and, you know, show the adventure there. And I don't want to be a travel channel. I don't want to be I mean, maybe a review channel, maybe like, hey, the Jurassic Park, I recommend it to everybody. And the, what do you call it? The escape room, recommended to everybody. But like, I don't want to go on a train and be like, just snobby or whatever and review it and be like, you know, this train just wasn't all that great. I want to be a sick person that travels because I think I've come to the conclusion that I've been sick my whole life, and that might not change. I mean, I'm 41. might not change. So that's a thing that I've had to realize, and I don't like it, but at least I have a goal. At least, you know, I would like to take you guys with me on any adventure that I do have going forward, which was my plan to begin with, but now it's more etched out, I guess. I'm not really having a good time with this right now, so okay. So, as promised, I'm going to go over the Tapenlar and Mechanist. Basically, they gave me this really neat tote, and I don't really know why, but okay. Again, I am not sponsored. I am just telling you what I am going through. Stellara also hasn't sponsored me. I don't think that they do that kind of thing, but, you know, if they do, I mean, they're better than, for me anyway. Again, for me, this is all for me. This is my opinions, my personal preferences, my cancer, my Chrones, you know, my stuff. I'm not recommending anything. I'm just taking it. I do think that Stellara for me is better than Remicade. Yeah, that's what it's called. Because I was still bleeding and everything, and just internally doing stuff that sucked. So in this really nifty bag that Tapenlar and Mechanist gave me, I don't know where that came from, but they gave me a really neat thermometer because I am supposed to take my temperature whenever I feel hot. And that sounds weird, but whenever I feel hot or extremely cold or cold at all, I don't know. I'm supposed to take my temperature, and if it gets past 100, I think 100 degrees, I need to go to the hospital, like I said already. But I think it's very interesting that they want me to stay there to get an IV, and they want to monitor me. But also, if I do spike a fever, I need to stop taking the Tapenlar and Mechanist altogether until my fever goes down, and until my fever goes down for 24 hours. So, yay. And then I got this, tips for managing fever. So that's something to look. I didn't look at this one actually before. They did say that I need to, they have like a little card in here that I need to carry around. Yeah, little card, wallet card, so that if something happens while I'm, oh yeah, and they put my oncologist name and everything on it, so that if I am lost somewhere and I pass out, or I don't know, other things attributed with the fever or whatever, that they need to know that I'm on this. So I don't like that, but I'm trying to put a happy spin on it because I'm going to go through it. And if I hate every second of all of it going forward, that just doesn't make any sense to me. 'Cause, I don't know, just And I'm not saying be happy. I mean, again, emotions are emotions. If you feel bad about something, then don't pretend, but I would rather just look at it the best way I can. So yeah. Okay. So I had a big thing in my hair, so trying to fix it. I am like the weirdest person when it comes to my hair. Arr. I want it to look great, but like not. Anyway. Okay. So here is the paper. So, Mechanist, this is the Mechanist specific information. Okay. So, they did talk to me about my personal like interactions that might happen with it. And so, you know, we'll just go through it because I was laughing because you'll see. Okay. Okay. Oh, you shouldn't, you know, it interacts with birth control, of course. Okay. How should I take Mechanist? Yeah, this is the one that was in the refrigerator. So, I have to take it 1 hour before or 2 hours after a meal, which to me is better because when I got the surgery for my arm, I started to get nauseous with the oxycodone. And they were like, well, take it with food. So I had to remember, like, how much food do you take it with? So I gained, like, a little bit of weight then. And, because you have to take it with food. And, of course, if I have to take it every 4 hours, freaking I'm eating all the time. So, well, 6 to 8, 4 to 6. Somewhere around there. Maybe 6 hours. I think it was 6 hours. Because I had to take the antibiotics at the same time. So... yeah, it was rough, and I had to always eat, and I had to, oh, and I know they say full stomach, but it just always made me nauseous. So yeah, I'm glad about this one because, you know, I could just take it when I wake up and not really worry, I guess. And it does say that I have to take it every 12. Well, this one is once a day, so once a day, every day. For a year. So it says heart problems. Now I have a fast heart rate. So that's going to be interesting it feels like your heart is pounding or racing. That's constantly. That is an everyday occurrence. I don't know what to do about that or say about that, but they basically, if it's worse than I normally feel, that's when I'm going to start to be concerned. And so, yeah, eye problems. Now, again, laughed because I get migraines, and it says that if I get blurred vision, loss of vision, or other vision changes. So, with just me, blurred vision kind of happens. Like, I'm not sure if it's a medication that I'm taking, you know. Well, I don't think so because I've been off basically all the other medication. I don't know. Anyway, and I get these like floater things because of the migraines, and I get auras, and they say to look out for those. Yeah, right here. If you see color dots, which again is a migraine thing for me, because I get these little, I call them twinklets, and they're just like little, I don't know, like they're like sparklers that kind of come in and out of your vision. That doesn't make any sense. Let me see. I don't know if anybody's had like a really bad head rush or whatever, and you see those like little twinklies. Yeah, sometimes I just get those. Cause yeah, so anyway, yeah, so halos, which again is, for me, it's, well, for a lot of other people, it's called auras when you get migraines. And yeah. And And then eye pain, swelling, redness. That is something that I normally don't get. So I'm not worried about that part because I normally don't just have eye swelling, which now that I'm saying that out loud and that may cause it, I don't like that. I don't want to get swollen eyes. Eye pain, again, it's kind of the same thing. My eyes sting sometimes, like the ball itself kind of throbs sometimes, and I think that has something to do with my headaches or migraines, but it just happens, so I kind of deal with it. Okay. So here we go. For those of you who know me, which is probably, not even probably, which is all of you right now that know me personally, know that this is extremely funny. So, if I get shortness of breath or cough, walking up the stairs right now because I'm so out of shape, and I am thinking that recently, like, I've been having allergy problems because the wind has been insane here. I've never known this amount of wind where I live, maybe ever, since I've lived here. So I think it's odd that I would just have a sore throat and cough and not breathe, or not be able to speak for a little bit. So just, yeah. And cough. I always have a cough. So again, and then it says fevers and serious skin reaction. So out of nowhere and for no reason, all of a sudden, like what? Wednesday, I want to say, yesterday or Tuesday, I started to have a very itchy underarm. Okay. And that doesn't look as bad as I thought it would, but yesterday it was all red dotty, and that one too. So basically, again, they're concerned about the underfoot, and blisters or peeling of the skin, mouth sores, blisters on your lips. Oh gosh, this is so bad. High fever or flu-like symptoms, which, that's, like I said, earlier. Enlarged lymph nodes. Now, my thyroid has been off for a while. I don't know. See, I'm not sure what part of this is fat or thyroid problems, but yeah, okay. So they said that on this medicine, I can have surgery on my thyroid if that's necessary. I have a thyroid needle check thing in a couple of weeks, and I'm not looking forward to that, but they're going to do a needle biopsy to see if they're going to take my thyroid. Now, I thought that they were going to take it, already, but whatever. Things are not progressing as fast as I would like them to, because again, currently as I sit here, I have an enlarging thyroid and I have cancer. So I don't like that. I'd like to, have as less things to worry about and cause me pain. Yeah, as I possibly can. So I want to be like you. So, yeah, so the most common side effects, again, so here we go. So the most common side effects are rash, which I already get, and they're itchy, and they're under my arms right now, but they can move at any time. Okay, so bowel movements, I guess. I've never really had a normal one ever in my life, because I'm missing 3 inches of my intestine, and I have an anastomosis and whatever. It's always been So I am thinking that every person who is sick has what I get normally on an everyday basis. So I can share that with you if you ask, but I'm not, again, sure what YouTube will allow. So when you guys are sick and have a stomach bug, so yeah, okay. My gosh. And then swelling of the face, arms, or legs. So I have, oh gosh, lymphedema now. And this, these two get really swollen now. Anyway, like, I don't know if you can tell, that's more defined than that one is. Yeah. Anyway, so I get lymphedema now. So that's going to be an interesting thing to tell apart. What is swollen and what's... Yeah. So fever, rash, nausea, chills, diarrhea, vomiting, high blood pressure, swelling of the face, legs, and arms. Those are the most common side effects. Fever, fatigue, nausea, headache, rash, chills. Okay, that's the same list, and I don't know why they have it here so many times. Yeah, they have it again. Most common side effects. When, yeah. Vomiting, chills, bleeding. Oh, yeah. So they were talking about that too. So I need to start taking my iron pills again because I'm not sure. Like, when I go out for a walk, like, I don't know, longer than a mile or basically, if I go and exert myself, because I've tried to walk in the house on the treadmill, I've tried to walk outside, I've tried to do squats and push-ups and things, I bleed from a very not normal or right place. So so I've just learned not to really exercise anymore at all. So it did help, but if I bleed, like, I have to up my iron because I've had a history of transfusions and irregular bleeding. So that's going to be fun to look out for. I'm going to have some really great updates for you guys. I do understand that it's a necessary evil, though. I understand that it's not every day. I understand, you know, there's a lot of stuff that I get, you know. So that's it for the mechanist. She said mechanist. Okay. So the Taffenlar, that's a shorter list of things, but so it says not to become... Sorry. It says not to become pregnant. So birth control, same kind of thing. I'm supposed to take this one twice daily, though. Every 12 hours. The same thing, though. Don't take it at least 1 hour before or 2 hours after a meal. Oh, same kind of thing with heart problems. Feeling like your heart is pounding or racing, shortness of breath, swelling of your ankles and feet, which again, because I have arthritis. So yeah, good luck. Again, that's basically what she said. If it's worse than normal, okay? So, ow. Oh, feeling lightheaded. That's something. Eye problems, same thing. Halo. Blurred vision. Sorry. I'm sorry for the yawning. I really am. I'm not boring myself. It's just I'm not used to talking this much. Like, lengthwise, I guess. I don't know. um, call your call your healthcare provider right away if you get a fever during treatment with Tafinlar. Yeah, same thing. Serious. Sorry. Serious skin reactions. Rashes is a common side effect. Ooh, again, blisters or peeling of the skin. Oh, blister with the lips. And basically, it's the same kind of thing that I just went over. Oh, that's the one. All right, that's kind of what I wanted to talk about is headache, fever, joint aches, which again is I have arthritis, so they kind of hurt a lot all the time anyway. So hair loss. Now, I am not going to sit here and whine about, I mean, my hair has been thinning for years now and it's gray and kind of, and I'm not going to feel bad really about what is going to happen, but just, I think that one might bother me more than anything else because everything else I've gone through, everything else I've done, and the pain, and I'm kind of used to it. So I kind of know, I know what it's like. But the hair loss, that I think that might be. I really do like my hair, so yeah. So just sad about that. There's the feet one. Okay, so redness or swelling. Okay, redness, swelling, peeling, or tenderness of hands or feet. I have I have yeah, I don't know. I took my medicine yesterday, so I don't know if you could see it, but I have it usually gets worse. It was worse yesterday actually. That the side right there. I have eczema. Eczema. I have eczema on my hands, and that was recently diagnosed within maybe the past 2 years. So, yay. Fever, rash, headache. The only place it gets, except for maybe that rash right there might be an eczema kind of thing, but I don't get it anywhere else really except for my hands because during the winter I wash them a lot and they itch hugely. So, and that one is store at room temperature and everything's fine. And so those are the medicines and those are the side effects and problems and all the stuff that I will be facing, and I will remember to bring you guys along with me on the ride. So, I don't know. I'm not looking forward to it, but I'm looking forward to getting over it, I guess. Again, I didn't know it was going to be a year, but it is. And it's not as bad as I thought. I thought that I would be sitting on the bed or laying on the bed for a year, not being allowed to go anywhere or go near anyone even, because I would be radioactive. That also does. So, for both medications, no one is allowed to give it to me, because I think there is some radiation in it. And if I am the only one allowed to touch it because I'm taking it and I'm the only one that's really exposed to it. I'll show you it in a minute, or I'll show you it when I start taking it. But the Mechanist, the one that came in the fridge, it has 2 bottles. There's a bottle within a bottle because like you can't even touch the bottle, I guess. So it's bizarre. Well, I think it's bizarre. I don't know. Um, so, that is basically it for this video, I guess. I think today or tomorrow, maybe tomorrow, I'm gonna go take a blood test because they want me to, take one to see how my levels are right now, and you know, maybe on Monday or Tuesday I can start taking both medications. And that's it for now, and I will see you in the next one. I am planning on the next one having some singing in there because I miss singing and I would like to share it with you guys. And I've had some difficulties. I was singing yesterday and I caught it on video, but it didn't transfer over to the SD card that I have. So it's a whole thing. I'm still trying to figure this out. And, you know, hopefully I'll get a... I'll figure it out. Thank you very much for watching again. And I'll see you, what? Monday? Maybe? Because I think that's maybe Sunday? I don't know. Oh, right. Please have a very happy Easter if you celebrate that kind of thing. And if you don't, have an amazing Sunday. And I will probably see you on Monday. So thank you very much. Have a great weekend.